Time to take my heroin. Ah, that's nice. No!
Today I'll be presenting my multimedia presentation on hepatitis type C and how it affects the human body, specifically the digestive system, or the gastrointestinal system. The digestive system is a crucial part of the human body as it allows for us to metabolize, create energy for each cell via the breakdown of food and liquids chemically and mechanically. These substances and nutrients travel along the GI tract so the body gets what it requires for growth, energy, and tissue repair. Without one or the other, the entire system starts to deteriorate. The digestive system starts with the mouth, where food is broken down mechanically by the teeth and then chemically broken down further by saliva. The pharynx then swallows the food, and the esophagus transports food via muscular contractions. Then in the stomach, it stores and turns food to break it down mechanically and chemically, and instead of saliva, we use gastric juice within the stomach, which also chemically breaks down food. The small intestine then breaks down food particles even further before the ileum, with the assistance of villi, passes nutrients into the bloodstream via its connection to the capillaries. The pancreas secretes a hormone known as insulin, regulating the amount of sugar, or glucose, within the blood. The liver plays various roles in managing the body. Hepatitis type C mainly affects this part of the digestive system. The liver breaks down fats using the bile stored within the gallbladder. It stores vitamins and minerals, destroys old blood cells that aren't needed, and it filters and processes impurities, drugs, and toxins going into the body. After all nutrients are absorbed into the bloodstream, the waste left moves through the large intestine, where feces is stored within the rectum before being released out the body through the anus.
So what is hepatitis? Hepatitis is the inflammation of the liver due to various infections and diseases. Hepatitis type C is specifically a type of strain of the hepatitis virus that leads to chronic infection of the liver. In each strain affects the human body differently and is caused by various factors. Hepatitis C is transmitted via blood contact from an infected person. Today, most people become infected due to intravenous drug use, especially when unsterilized. Hepatitis type C specifically targets the liver, and it severely hinders the liver's ability to digest food due to how the liver starts to produce yellow bile, or bilirubin, instead of the usual bile, indicating liver damage. Hepatitis type C can also lead to cirrhosis, which is a type of liver damage involving scar tissue replacing healthy cells. Symptoms of digestive problems would be nausea, vomiting, loss of appetite, weight loss, and abdominal pain. Comparing a regular and diseased state of the body system, with hepatitis C, early on the joints and muscles will ache and feel sore, showing that your body's immune system is attempting to fight off the infection. You'll feel greater fatigue and have memory issues, and the inflammation of the liver can also lead to blood flow blockage, and a lack of circulation leads to swelling. Jaundice is also especially prevalent as bilirubin builds up, and the eyes and even skin turn yellow. The intestines are affected as they can't properly absorb nutrients because scar tissue is now replacing healthy liver tissue. However, scar tissue does not digest food as well as healthy liver tissue does. Medical treatment. So, specifically for hepatitis type C, when it is new, it doesn't always require treatment. The immune system can potentially clear the disease before further treatment is required. However, early onset hepatitis type C is hard to identify as obvious symptoms don't appear until the liver has already been greatly damaged. Hepatitis type C is treated with antiviral medications, specifically pan-genotypic direct-acting antivirals, or DAAs, which are a combination of antiviral drugs chosen to treat hepatitis type C, working against every genotype. The new treatments are tablets taken orally daily for 8 to 12 weeks. You can also improve your liver health in general by maintaining a well-balanced diet, doing regular exercise, and reducing the amount of alcohol intake and decreasing your stress. The effectiveness of treatment is that it can be shown through statistics such as 94% of those with chronic hepatitis type C being cured of the disease since the recent development of this new treatment from 2016, which can treat all strains of hepatitis type C. It's effective for those with or without liver damage or advanced cirrhosis. The medicine is still being improved, and many people reportedly feel better once taking the medication. However, there's still some mild side effects such as headaches, fatigue and tiredness, nausea, and gastrointestinal symptoms. For my case study, I actually studied a patient named Brand Weidlin, who's a 52-year-old Caucasian female who works as a medical laboratory scientist. She was diagnosed with chronic hepatitis C in 2009 and was unaware of the infection. She was infected by the disease via her exposure to infected blood because of her career, and Ms. Weidlin also had diabetes, hypertension, and alcoholism, adding to her problems with her digestive system. At first, there weren't any symptoms, but over time, she felt much more fatigued, lost weight unexpectedly, and had consistent diarrhea, and also felt that her body was weak in general. Upon examination, it was determined by a fibro test that her Menavir fibrosis score was a 2, meaning she was between F1 and F2, showing that scarring had occurred and extended to the outside areas of the liver that contain blood vessels. The standard treatment, as mentioned before, is the usage of DAAs, which is a recent treatment only developed in 2016. In Ms. Weidlin's case, she did not have access to such treatment, so she was met with the older treatments shown here. They prevented progression of hepatitis C and managed her blood sugar levels. Such older treatments would have more side effects such as weight gain, body aches and pains, and low blood glucose or hypoglycemia. Additionally, she was also treated with physical therapy to improve her cardiovascular health and musculoskeletal health. This treatment was used for Miss Whiteland specifically because it was what was the best at the time and most available at the time. It was also important that she was treated
based on her various symptoms, and that physical therapy was considered as much as medical treatment was. A combination of two helps to allow for the greatest chance of recovery and overall improving her quality of life. So here's my reference. Thank you for listening. And thanks, Ms. Jaden. Yes, we love Bio 1 too.